eNRMC and aged care. So what is an electronic national residential medication chart, and how does this differ from previous methods of capturing medications in a residential setting? So before we discuss what is eNRMC, I will need to provide a quick recap on the current medication management state of play in residential care across Australia. So historically, Australian residential care homes have been using one of three different medication management systems. So paper-based, hybrid, or completely electronic. So paper-based systems, these medication management systems is when your prescribing, supplying, and administration processes are all paper-based, using either the eNRMC, which is the non-digital version, the form for completing the medications, or a commercially available medication chart that meets the eNRMC requirements. Another paper-based medication chart could be used, which must be supported by separate prescriptions for prescribing, supplying, and PBS, repatriation benefit scheme, or claiming purposes. And they're the only scenarios for the paper-based. But the hybrid way of doing things, so this medication management system uses a combination of paper and electronic prescriptions and administration charts. So this often involves the following. So there could be a handwritten medicine order. They're prescribed on the residential care facility's paper chart. If this medication chart is not the paper version of the eNRMC, the medicines ordered need to have a separate prescription to be written by the prescriber for dispensing and PBS RPBS claiming at the pharmacy. That's for veterans. So the PBS and non-PBS prescriptions may be computer generated from prescribing software systems, printed and then hand signed by the clinician. So where this complies with state and territory law, because they differ a little bit in each state and territory. So, or may well be electronically generated by the prescriber through their prescribing software systems and made available for dispensing through the prescription exchange service, as electronic prescribing in the community becomes more and more widely available, utilising that kind of methodology. Now, records of administration, which are the signing sheets, are compiled by the consumer's pharmacy to allow nurses to document, so electronically or by hand, depending on the system that was available to them. So the medicines that they've been administered to the consumer. The records of administration compiled by the pharmacy will include instructions for medication and administration and the handling of the medication and the storage of the medication. So hybrid systems are not Australian Digital Health Agency conformant prescribing systems. This means they are not eligible to electronically prescribe or dispense any prescription medicines, nor claim PBS entitlements. So the eNRMC system is what we're going to be talking about today. So for those who were listening in on the previous session where we talked about electronic prescribing, let me highlight now the pointed difference between electronic prescribing versus the electronic national residential medication chart. So a general electronic prescription is a digital version of a paper prescription. A consumer or their representative can use their electronic prescription token to take or send to pharmacy for dispensing, more commonly used in the community. The eNRMC is a resident's medication chart that enables prescribing, supply, and administration of medication in residential aged care homes. So what exactly is an eNRMC chart, medication management system? So an eNRMC is a type of electronic medication system that enables legal electronic prescribing, supply, and claiming of PBS and RPBS, which is repatriation veterans, medicines within a residential setting. So a resident's eNRMC is created and managed in the eNRMC system. It is a single source of truth for the medication information. So it allows prescribers, pharmacists, and residential staff to access enter and review medication orders electronically using desktop computers, handheld or mobile devices. It may also provide clinical decision support tools such as alerts and reminders to assist with safe and appropriate prescribing and dispensing and administration of those medicines. So more specifically, the eNRMC legally supports electronic prescribing and the supply of PBS medications directly from the resident's medication chart without requiring separate PBS prescriptions. So there are some exemptions to the rule. So special arrangement medicines, which are called the Section 100, and complex authority scripts, which are CAR medicines, these still require a paper prescription. Examples of Section 100 programs are highly specialized drugs. So these could be medicines for HIV, or like clozapine or opioids. Efficient funding of chemotherapy. So the program covers injectables and infusible chemotherapy medicines. So these are examples of exceptions, and other programs like botulism and growth hormones. These medications are exempt. So the Australian Commission on Safety and Quality in Healthcare has created a wonderful tool. This is a really, really great resource, and there's a hyperlink within the resource page, and it's essentially got a whole suite of audits that you can do at the end of during the implementation of eNRMC, just so that you can check where you're up to and making sure that you've got an alternate system in place to go alongside your implementation, so that you don't obviously miss any gaps whilst you're trying to implement something new. So really good resource, highly recommended. So let's look at the patient journey in residential using the old version, so with the paper version, so the old paradigm. So looking at this patient journey, you can see that from this graphic, there are 10 touch points from the time the GP visits the patient, prescribes the medication, to medication administration, plus one extra step, because you might go, oh, there's 11 there, plus one extra step needed for the completion of the whole transaction, which is when the pharmacy lodges a PBS claim. I won't go through each of those and talk to them, but needless to say, it's a long and winding road just to go through the process of prescribing and administering and claiming. So a temporary solution was put in place. So the implementation of the transitional arrangement, which many of you may be across. So in July 2022, the Department of Health, Disability and Ageing introduced the eNRMC transitional arrangement. So this essentially has proven to be a temporary fix. So this allowed residential homes to adopt transitional versions of the electronic National Residential Medication Chart system without requiring each individual residential home to be approved by the department to participate. So systems had to meet the conformance to legislative and technical requirements at the time to be considered for this transitional system to be put in place. So what does the patient journey look like during the transitional adoption of the electronic National Registration Residential Medication Chart? So it means it's not fully conformant with national standards. So as you can see from this graphic, there are this time 6 touch points, which is less than the paper version, from the GP conducting the patient visit, writing the prescription, to medication administration. However, there are still some extra steps that need to occur for the whole process to be complete. Why? Because the software systems that adopt the traditional eNRMC, I'm going to stumble over that a few times, I apologize, actually do not connect to the National Prescribing Delivery Service, the NPDS, for the electronic prescribing, meaning pharmacists must still manually transcribe prescription information, allergies, and adverse drug reactions from the eNRMC into their own dispensing software. This is not ideal. So the transitional arrangement for eNRMC is ending. So the transitional period will conclude on February the 28th, 2026. So we've got early next year, with a final deadline for all residential aged care homes to transition to conformant eNRMC by March 1st. That's kind of like the end deadline. So according to the Australian Government Department of Health and Aged Care, this means that after this date, new medication charts should not be created under the transitional arrangement. All software vendors have been given a deadline of 30th of September this year, 2025, to ensure their products meet the new legislative requirements. So implementing the eNRMC into a facility or aged care home. So once a residential home has decided to implement the new system, there'll be a few steps that you need to go through. So you need to support all your staff. You need your aged care site needs to have some formal training, of course, from the software vendor that's providing you with the product to ensure that they're all comfortable with utilizing the new software. And your aged care will ideally need to have some digital change champions, so people that are nominated to be those ones that are going to drive the change amongst all the staff to make sure that they all progress with their education and development throughout the facility with the new model of doing the medication delivery. Your aged care home will have several types of prescribers. So including the regular authorised prescribers, your regular GPs, but you also have some temporary visiting prescribers such as locums or after-hour GPs, to ensure that all of your prescribers can utilise the eNRMC system. The aged care site must have your clinical manager trained as an authorised eNRMC system administrator. So they were able to provide temporary access for new prescribers to ensure all medication management remains within their software. So you need to have that appointed person that oversees all that. So some residents potentially may wish to continue with their own pharmacy that services the facility under a contract. So the aged care site will need to make sure that the software vendor honours all requests that these pharmacies are trained. They're all trained equally. This makes sure that everything is streamlined to make sure that you maintain safety and quality for your management of all the medications for all of your residents at the facility. So the patient journey with a conformance system, what does that look like? So in this graphic, you can see there are also 6 touch points. However, you will note this also includes all of the necessary steps. So this is from the GP's perspective, from the residential home's perspective, and the pharmacist's perspective. Everything is done. So the residential home can access the eNRMC for comprehensive real-time view of the medication chart with prescriber and pharmacy notes all attached. Once the GP has completed their resident consultation, for example, and this can be done, of course, in person or via telehealth, they then log into the eNRMC, prescribe the medication. This creates an alert on the pharmacy system, prompting them to then review that, to process it and prepare and lodge a claim for PBS for this new medication. They would dispense it, of course, and then have it delivered to the residential home. Then the nurse at the residential home will receive that medication, and then they'll jump into the eNRMC to make sure that it compares with what they physically received, and then also be able to compare it against the original GP order, which is the prescription. Then this can be administered and recorded against the patient within the eNRMC. So it's kind of like a one-stop shop. Everything you need is there. So please note, fully conformant eNRMC med charts will be valid for 6 months and will no longer need to expire at the end of the month. So this is different from the transitional model, which is currently in place, which has a 4-month expiry. So again, what could this potentially look like as part of a workflow? So the nurse reviews the medication chart and checks it against the resident's medicine. The nurse administers the medicine to the resident, and the nurse enters the admin event into the eNRMC. So let's look at the benefits. So for the resident, improve safety. So reduces medication errors by ensuring clear, legible, up-to-date prescriptions, minimises duplication or missed doses through real-time updates and alerts, captures allergy and adverse drug reaction details, better continuity of care, accessible by all providers, ensuring consistent care, supports timely medication review and adjustments. Enhanced privacy and security, so secure digital records protect patient information better than paper charts. Audit trails help track who accessed or modified the medication data. Empowerment and confidence, so more confidence in the quality and safety of care, personalised and responsive medication management, and the residents retain the right to choose their preferred doctor, of course. So transferring to and from hospital. So the residential site should cease the eNRMC when they're transferring a resident out into a hospital, and if the patient is returning, they need to reactivate or start a new one. So if they do go to hospital, the hospital will review the medications provided to them, but they would do it through their My Health record. And then they'll create their own medicine list whilst they're in hospital. So when a resident transferred to an acute hospital, I'm not sure if you are across the resident care transfer summary, which has been a piece of work that has been done to enable residential care homes to actually upload information into My Health record. At the moment, you have viewing capacity, but as software developers become conformant and have got their product up to scratch, you should all have the capacity to upload a document. Where I'm going with this is that eNRMC should be a piece of documentation that you'll be able to upload as part of the hospital transfer summary. And for those of you who are not across it, it's essentially the digital equivalent of having a yellow envelope. So when someone gets transferred, you put all that relevant documentation in there about their mobility, their cognition, their dietary needs, the rationale for going in to hospital in the first place. So an incident, had a fall, potential query, fractured nerve. So the eNRMC will be a piece of documentation you can potentially electronically link across for the hospitals to view. So considerations, what do you need to do? So obviously there's some governance that needs to be put in place. So appropriate governance needs to be managed effectively to support the medication safety and quality of use of medications as an ongoing basis. So this is often the role of the Medicines Advisory Committee, whoever that may be, at the residential home. Authorised personnel access, so only authorised personnel have access to the eNRMC with role-based permissions, allowing them to perform permitted actions, for example, prescribe or administer. Access to a residence chart will be based on the need to provide care and aligned with the user's legal permissions under state and territory medicines and poisons legislation. User training, so eNRMC users should be appropriately trained before using the system with ongoing reviews for the need for refresher training. So this kind of needs to be built into your admin infrastructure. So eNRMC vendors should be providing user support and training. Working relationships, so processes and policies are in place to support effective working relationships with prescribers and the pharmacists, and also you'll need to have an after-hours contact available as well. So what are your next steps? So talk to your, you may be from the clinical governance team, or talk to someone within your clinical governance team to find out where your provider is up to with regards to implementing eNRMC. To achieve compliant eNRMC status, residential aged care need to adopt a system listed on the Australian Digital Health Agency's conformance register. So if you may be across that yours is conformant already, if not, we do have some links to the conformance register that tells you whether you are or not. Talk to your eNRMC software vendor to determine a timeline for implementation, and also whilst you're talking to them, talk to them about support and training for all your staff to safely transition your site to an electronic prescribing conformant system. Don't forget to refer to the resource that I mentioned previously, which is by the Commission, and I will link that in it's already linked in at the end in the resources. That gives you some self-auditing tools so that you can see where you're up to. And also you need to talk to your pharmacist, start the conversation if you haven't done already, just to find out what their thoughts are and where you're all at with regards to implementation of the process. So there's a few steps that you need to go through there. So we've got a whole suite of resources here, so I won't go through them other than just say they are there. You can see at the bottom, conformance register that you can refer to. There's some contact details. There are some eNRMC specific emails there and website to give you all the relevant and necessary details. By all means, do not hesitate to reach out to